Good evening. My name is Jennifer McKenzie, and I am the Chief Operating Officer for Vancouver Coastal Health Richmond. As Chief Operating Officer, I lead a dynamic team that's responsible for healthcare services and programs in Richmond, spanning acute care services at the hospital, to home and community care, residential care, and mental health and substance use programs in the community. I grew up in Cape Breton, Nova Scotia. My father was a doctor and my mother was a nurse, so medicine and healthcare have always been in my blood. I've worked in healthcare for more than 25 years in many locations, from Alaska to the US Virgin Islands, from Boston to California. Before coming to Richmond, I was Vice President, Strategy, Transformation, and Innovation at the Provincial Health Services Authority. There, I led the clinical and functional planning for the new Children's Hospital, making sure we have the best possible care for children in our province. Over the past 3 years, together, our team of doctors, nurses, healthcare professionals, and hospital leaders have made tremendous progress to close the gap on some of the healthcare needs here in Richmond. We are also seeing an exponential growth in our population. Our population has quadrupled since 1966, but the number of hospital beds has only doubled. We also have the fastest growing population of seniors in all of BC, which will place extreme pressure on our ability to provide care in the future. We want you to know you'll receive the best standard of care at Richmond Hospital, but we need a facility we can count on.
My name is Matthew Kwok. I'm one of the emergency physicians at Richmond Hospital. The statistics for Richmond Emergency Department is that we're almost reaching 60,000 patients a year. Every year it seems like we break records. We know that the community is growing quite quickly, and the number of seniors in our community is growing quickly as well. So the amount of pressure on the emergency department is great, and we foresee more growth in the near future.
About 11 years ago, I find myself have a little bit chest pain. And then I told my wife, I have a little bit pain here. She said, do you need to go to hospital? I said, no, I don't need. And then until the next day, I feel a little bit worse and a little bit dizzy. Then my wife, don't wait for other minute. So I go to visit Richmond Hospital. All the nurse and all the people, they come so quickly. And then I feel I'm in a very serious conditions.
I was actually a little bit worried. I kind of has a little bit of warning that something might happen, and then he actually has to be bedridden.
If I tell you I'm not scared, I'm telling you a lie.
I think he thought he's going to die. You know, the feeling is. He even told me that it's so painful, I'm going to die.
It really scared me a lot.
Mr. Chan came to the emergency department. One of the things that we worry about is that this can be a heart attack. The medical imaging plays a crucial role in making the diagnosis so that we can move forward and treat him in a timely basis.
Anthony would have had a myocardial perfusion scan, which we also call a MIBI scan or a nuclear medicine stress test. And so in this test, the patient is injected with a radioactive tracer that goes into the heart. And if there's a blood vessel in the coronary arteries that is narrowed, that area of the heart doesn't get blood flow and doesn't get the tracer. And so when we take a picture of the entire heart using our nuclear medicine camera, there will be a cold area in the heart that confirms to us that there is a blood vessel that is narrowed.
The medical imaging plays an important, crucial role in making the correct diagnosis for patients in the emergency department. Mr. Chan, for example, we have used medical imaging as a modality to make sure that we make the right diagnosis.
Matthew Kwok, he is very careful to check everything. And then I find out I have some heart problems. Matthew told me if I come into the hospital later than half an hour, the first thing I will have is a stroke. The second thing I will have is a heart attack. So I'm lucky to go in the hospital on the right time.
Anthony's symptoms were such that he was transferred to VGH and then had more invasive testing there and eventually required a bypass surgery to help restore the blood flow to his heart.
When I saw him, back to the Richmond hospital, he was very happy, and telling me that he is very relaxed there.
After a few days there, I feel like at home because everybody is so nice. We talk and the doctor come all the time. Matthew Kwok always on spot. You will need him, he's there. And a lot of other doctors also, that they are very nice doctors.
In a lot of ways, Mr. Chen represents a good example of what we see in the community. Seniors often come into the hospital with quite complex medical history, and because of that, they need quite complex care. Their need for investigations through lab or medical imaging is also increased because of their complex medical history.
Radiology and nuclear medicine are specialties where technology evolves at a rapid pace. So we have 2 nuclear medicine cameras, which were both purchased in 2004. The usual lifespan of these nuclear medicine cameras is about 10 years. And so as this equipment gets older, the parts become more difficult to replace and the breakdowns become more frequent. And so a new nuclear medicine camera would give us better technology, better imaging inside of the patient, and also allow us to either increase the image quality, decrease the radiation dose to the patient, or increase the amount of scans that can be done on that one piece of equipment.
If we saw him, Anthony, like 11 years ago with today, like a before and after photo, you will see a healthy change on him.
I think we should thankful the doctors and the nurse. Without their help, maybe I'm a different person, but with their help, I'm healthy.
Donors and community leaders play an important role here at Richmond Hospital. We would like the donors to know how grateful we are for the leadership role that they've played in purchasing vital medical equipment and new facilities for Richmond Hospital.
The donor, I really want to say a big thanks to them, but I don't think that's enough. They are making a big difference, to our life and to our world.